One of the really disturbing findings out in public health there is never ever make the mistake of being poor or being born poor. Your health pays for it in endless sorts of ways, something known as the health socioeconomic gradient. As you move down from the highest strata in society in terms of socioeconomic status, every step down, health gets worse for umpteen different diseases. Life expectancy gets worse, infant mortality rate, everything you could look at. So a huge issue has been, why is it that this gradient exists? Totally simple, obvious answer, which is if you are chronically sick, you're not going to be very productive, so health causes drive socioeconomic differences. Not that in the slightest. On the very simple level that you could look at socioeconomic status of a 10-year-old, and that's going to predict something about their health decades later. So that's the direction of causality. Next one, what's it about? Oh, it's perfectly obvious. Poor people can't afford to go to the doctor. It's healthcare access. It's got nothing to do with that, because you see these same gradients in countries with universal healthcare, socialized medicine. Okay, next simple explanation. Oh, on the average, the poorer you are, the more likely you are to smoke, to drink, to all sorts of lifestyle risk factor stuff. Yeah, those contribute, but careful studies have shown that explains maybe about a third of the variability. So what's left? And what's left is having a ton to do with the stress of poverty. So the poorer you are, starting off being, the person who's $1 income behind Bill Gates, the poorer you are in this country, on the average, the worse your health is. This tells us something really important. The health connection with poverty, it's not about being poor, it's about feeling poor.
Increasingly, we recognize that chronic stress has an important influence on health, but the most important sources of stress are the quality of social relations.
And if there is anything that lowers the quality of social relations, it is the socioeconomic stratification of society. What science has now shown is that regardless of material wealth, the stress of simply living in a stratified society leads to a vast spectrum of public health problems. And the greater the inequality, the worse they become. Life expectancy, longer in more equal countries. Drug abuse, less in more equal countries. Mental illness, less in more equal countries. Social capital, meaning the ability of people to trust each other, naturally greater in more equal countries. Educational scores, higher in more equal countries. Homicide rates, less in more equal countries. Crime and rates of imprisonment, less in more equal countries. It goes on and on. Infant mortality, obesity, teen birth rate, less in more equal countries. And perhaps most interesting, innovation, greater in more equal countries, which challenges the age-old notion that a competitive, stratified society is somehow more creative and inventive.